So this is how it's coming out, right? Okay, so this implant has flipped. Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Today we have an interesting case. It's a problem and complaint that I see a lot of patients for. So this young lady comes in. She's had breast implants in for about 20 years. She always felt that they were too large, and now she'd like to get them reduced, the implant to a smaller implant, and we're going to do a lift. And so what typically happens on real large implants like what she has is they tend to drop in time, and then they tend to lateralize or go to the side. So what we need to do is a lot of pocket adjustment to be able to lift the implant and bring that back up into the position it should be in. And then we need to adjust a soft tissue to it, which is going to be the mastopexy. So these are also saline implants. She doesn't know what size they are for sure. By feeling and looking, I estimate about a 500 cc, but we'll see here in just a second. Okay, so the patient's prepped. We're ready to go here. And you can see here, when I said the implant lateralizes, I mean it goes to the side. Look how big that pocket has become over time. I mean, when she lays down, it literally looks like she has no implant at all. Obviously, the implants are going to move some, but what we really would like is a situation where it's more in this range here, not like that. And then also, it's dropped down this way, so she's got little to no fullness in the upper pole. So what we need to do is tighten the pocket both here and on the bottom, and I'm also going to use a piece of mesh to help me support that. I've marked out for the breast lift, which is going to be a vertical scar or a lollipop incision. These will be the incisions. The nipple's going to be moved up there. That's going to close there, then the rest of it sort of will come together. So I will surgically show you the key steps as we go along. Okay, so we're ready to get started. We put a tourniquet on just to get some tension, because that really helps with this incision and then removing the skin or the deepithelialization part. So go ahead and I'll make this initial incision around the areola, which I'm doing now. Okay, I've injected this with some local too to help out with the bleeding. And so okay, so this area here that I made this incision around, this, it's going to be deepithelialized, so this outer layer of skin is going to come off. On the bottom portion, we're going to take skin and breast tissue as well, and then we'll get down to the implant. So let me start removing that skin, and I'll come back and show you as we get a little further. Okay, so the outer layer of skin has been removed here, or deepithelialized, and then now I'm going to remove this triangular dart here, and that's going to be skin, fatty tissue, and breast tissue, and then we'll get to the capsule of the implant. We'll open the implant and remove it. We can see what actual size the implant is, and that will sort of direct us on what size we're going to use to replace it. Okay, so I made that incision, so I'm going to make this cut here. We'll take off this piece, but let me do that, then I'm going to show you something else here. So this white here, that's breast tissue, and of course the yellow, that's fatty tissue. Okay, so here's just really it's just a very small amount of tissue that we're taking off there, but you know, that's how it lied, so it's removed. So these implants, I want to point out this, they're under the muscle. Here's the muscle right here. This is the pectoralis major muscle. And you can see really, after all said and done, probably at least half of the implant is not under the muscle, because here's the muscle and here's the implant right here. And you never want to cover it completely, because when the patient contracts, it's going to move all over the place. So you have to release part of the muscle, but the bigger the implant goes, the more the muscle retracts superiorly, so the less that is actually under the muscle over the years. So if you have a small woman and you put a really big implant in, even though you put it under the muscle to begin with, it's probably not going to be under the muscle some years later. Anyway, saying all that, let's go ahead and make the incision here and take out the implant. So here's the muscle, so we don't want to go through that. So I'll make my incision down over here. You can see there is capsule, if you can see that. That's the capsule surrounding the implant. So I'll get my assistant to put the retractor there. And here we have an implant, and it's intact, and we knew it was intact because it's a saline implant. On saline implants, if it was to leak or rupture, your body's just going to absorb that saline. So let's go ahead and take that implant out. And so interesting, so this is how it's coming out, right? Okay, so this implant has flipped because this patch right here should be this way. But you saw how large that pocket was? And people often ask, how does an implant flip? Well, when that pocket is real big, it can do exactly what it did in time somehow. When it gets pushed over, it gets pushed to the side, and then it flips this way, which should be against the chest wall. So the markings on this is a Mentor implant, and it says 525 cc's. So saline implants have fill ranges, so this is probably filled to close to 600 cc's, but we'll verify that here in just a second. But here it is, a saline implant. 20 years later, it looks really almost pristine, and it's completely intact. So you can see they're very long-lasting implants, both silicone and saline. This one happens to be saline. So we'll see how much is there. I'm gonna start doing some pocket work, and I'll come back and I'll show you as we get a little farther along. Just wanted to show you, these are some of the sutures. So this is the capsule here. And so I'm putting sutures in here to tighten this capsule, but I'm also gonna secure mesh. It's right to this same area that I'm working on. And you can see the capsule is right underneath. It's got a lot of vascularity to it, which is not a bad thing. But I've already put a whole row of sutures. I've already put a whole row of sutures laterally, so right here I put, and this is kind of the end of this. Now I'm going to go ahead and put some inferiorly here. I'll check what I have, and then we'll start to pre-sew in the mesh, and then we'll have to sew in the other portion once the implant is in. So here's the mesh. It's absorbable mesh. It's made out of the same suture material that I use as well. So this goes away in about a year. So I've already, started off tightening the capsule, but that won't be enough, in my experience, to last over the long haul. So now we get this mesh in here, and I'm going to suture it. I'm going to pre-suture it in place along here and along here. And then once we put the implant in, I can set the tension by placing the sutures over here and on the muscle. It's just easier for me to get to this top side with the implant in than the bottom side. It doesn't really make a difference which side you suture in first and second, but technically it's easier for me that way, so I will get busy suturing that mesh in place. Okay, so here we have this saline implant, and yeah, it's a 225 cc saline implant. We have it filled to 50 cc's just to get the air bubbles out. So with this, you don't need a funnel, because you can just fold this in half, as I always say, like a taco. And you can come out there. So I've pre-sutured that mesh in place on the bottom already. So after we fill it, I can set the tension by leaving slack on this or making it real tight, depending on what we want to set the final implant position. So now we're going to go ahead and start filling. All right, so that's 50 in, 50 more makes 100. 150. 200. You can see it expanding. So this was 60 cc's, so 260. And let me have one more syringe. So that's 270 cc's. So now I can get a little bit better judgment of, you know, here's the inferior border of the muscle, here's my mesh, and so I can, like I say, I can, depending on what I want to do, I can make the tension a little looser or I can crank it up tighter. So I'm going to make that final adjustment, put those sutures in, and then we can start closing the actual incision. Okay, so here's the mesh. It's sewn in to the inferior border of the muscle, and you can see now that implant's really, it's secure, it's resisting it going down, it's resisting it going to the side. So what we need to do now is start to close. So this is the first of the two key sutures for this type of lift. So this one here is going to move the nipple up to a higher position. You can see what that did there, so it brought the nipple up. Second one's going to start closing, so there's kind of the two key sutures. So there's one there, and here comes the second. There we go, a better bite. Okay, my assistant will kind of helps me with this closure part here. All right. Okay. So now I think you can appreciate, you know, how it's going to all come together. And you see the difference here. It's a much smaller implant than here, but I mean, this implant, I mean, it's just literally almost in her armpit, as opposed to this one being in a good position. So this is going to be about half the size of what the other implant is, and that's what she wanted. So I'll keep working here, and I'll show you once we're done. So I'm done with this right side, and I've sat her up, and you can see really the significant difference. This is a 500, it was filled to 550 cc's, and this is 270 cc's. And in fact, you know, really, I would argue this looks much better because you have the fullness where you want it instead of way down here. But after sitting her up, I am not quite happy how this overhangs here. So I'm going to go ahead and remove a little bit more tissue, just so that doesn't cause a problem later and we don't have to come to do a small revision. So I'm going to take off that a little bit more additional tissue, and then we'll be done with this right side. So I have this ellipse of tissue that I'm going to remove. It's marked off here. And so now we just need to go ahead and make this incision. Take out this little bit of additional extra tissue, which I think is going to save us some time in the long run, because I think if I didn't, I'd be back here doing this same thing in 6 months to a year. So let's just go ahead and do it now. So I'll finish removing that small bit of tissue, and I'll close it, and then we'll show you once we're all done. Okay, so I removed that little dart of tissue there. I think that looks better. So I'm overall happy how this right breast looks. Now we're going to go over and do the same thing to the left breast. We're all done. So it ended up putting 270 cc on both sides, and we did the lift, tightened the pocket, used the mesh, so both sides are complete. And then we can come back up here, and you can see the preoperative picture. So you can see we really reduced the implant size by 1/2. and then adjusted the pocket and of course did the lift. So that's the case for today, as again I see a fair amount of patients that come through with large implants wanting to have them go to smaller sizes. Sometimes you could just exchange them, sometimes you have to exchange them, adjust the pocket, sometimes you have to exchange them, adjust the pocket, and do a lift. So it just depends on the situation. Anyway, I hope you like what you saw. If you like the content, give me a thumbs up. If you want to become a subscriber, you can see all the latest content.